We're here at the Ronald McDonald House of Hershey, and we have about 14 dogs that are with the American Red Cross Animal Assisted Therapy Program. These are pet therapy dogs, and normally we come one at a time, and these dogs do just a wonderful thing for the kids and families that are here. A lot of times it just find the comfort of a dog who will love and listen unconditionally. Hi, my name's Steve Turner, and this is our therapy dog, Tootsie. Tootsie is probably about the smallest dog, and you have dogs all the way up to the size of a Great Dane. And what really matters is that dogs that are good around families and children. And she came with me on Christmas Eve, because I always come Christmas Eve, and just charmed the entire house. We got Tootsie certified as a therapy dog, and she and I just come because we love to be here. There's a lot of families, the kids are in the pediatric intensive care unit, the neonatal intensive care unit, the oncology floor. They're in there for very serious conditions at times, life-threatening conditions at times. So this home, this Ronald McDonald House is a home. It is a place that cradles families and children when they are the most vulnerable. And these dogs come and they're part of that equation. And what they do is they allow parents and kids to have a break, to just focus on something other than, at times, what is as serious as can be.
Hi, I'm Tracy Joint, and this is my dog Hannah. Here, the parents and the children, of course, are dealing with their medical issues, and the parents are dealing with the children, you know, trying to keep them positive. So I think it helps them give a positive, you know, event to their evening. And one lady had said, we had a patient that smiled, and she said, I haven't seen her smile in 6 months. So that was kind of neat.
When you interact with a therapy dog, your blood pressure drops, your stress level drops. Dealing with children that are facing cancer, you have these kids, the chemo and the radiation, and their hair is gone. And they're these wonderfully beautiful little bald children. And so they're looking at really scary stuff. And they're feeling at times really bad. And you have this little face look at you and lick you and sit with you. And then you have kids who will sit there and they'll talk to you. What you see sometimes are kids who are frightened or traumatized, and they can calm down. They're scared and they get diverted. I mean, that's what you do. You divert from frightening things.
They're not going to ask you questions. They're just there to be with you. And sometimes you just need that.
This is just part of the process of calming and diverting and providing something that's positive and that is unconditional.
My son, who's 19 now, he had a heart transplant at 6 months old. He was back in, like 5 years ago, he was at Hershey, and there was a dog coming to the hospital, so he was very excited, and for days he was looking forward to the dog coming to the hospital, so I thought that's something I want to do when I have time and can pay it forward, kind of. He was having headaches, but yet he was still looking forward to seeing that dog. And I would have hugged the person that brought that dog just to get my son through a couple of days of uncomfort. Gave him something to look forward to. It's very rewarding, yeah. And Hannah doesn't seem to mind, so, so we enjoy it.
It's so powerful being here. You see people at times that they're most vulnerable, but they're also at their strongest. And that's the amazing thing too.